Okay, just so everybody knows I'm recording. So anything you say will be record. Hi there, I still see people are joining. Excellent. Hey Trace, welcome in. Hey Roxana. Hey Roxana. Okay, it is 2 o'clock. I'm gonna go ahead and get started. People can join as they can, but I want to be respectful of everybody's time, so we'll go ahead and get started. So welcome to the revamp of the Share Registry Users Group after a long transition, after a lot of work by a lot of different team members here at ADHS. We want to welcome you. And so here's the agenda for the first meeting. To be clear, this is the second meeting, but I'm holding two duplicate meetings. So in case you couldn't make one, this is the other. And so if you attended the last meeting thinking that this was a different meeting, you're not going to hurt my feelings if you drop off. But this is the exact same content that we're going to go over. But if you stick around, that's great too. I appreciate that. So we're just going to do some welcome introductions. We're going to have a look, do a high-level review of what the SHARE program is as an overarching idea, and then we're going to look at basically how to enter cases in REDCap. We're just going to kind of get straight into basically a tutorial about the new data entry tool that we have created here. So welcome everybody. Let me go ahead and share a different tab and let me share it in that mode. Okay, actually, my apologies. Okay. Excellent. Okay. Okay, yeah, so welcome. Let's go ahead and start with some welcome and introductions. If you wouldn't mind, take a moment, and in the chat, there's a little message box in the lower right-hand corner. If you wouldn't mind dropping your name or your role and perhaps your hospital if you're comfortable doing so. You don't have to, but it gives me an idea of who my team is. I want to welcome you to the Share Registry User Group, which we're calling Shrug for short. The Shrug meetings are intended to provide updates to and receive feedback from you, our hospital data abstractors. Historically, these meetings were held twice yearly, and the group can decide on what timing and meeting cadence works best for us. So let me know who's here, and I'll get to introducing some of our staff here shortly. The Shrug meetings are going to be held twice yearly. That's the historic meeting cadence that we've had, and that seems to be reasonable unless the group decides that we need a different cadence. That's fine too. For the SHARE team, these meetings represent the culmination of a lot of hard work, and I'd like to take a moment while you're all introducing yourselves, thank you, to introduce my team, starting with Dr. Gail Bradley. Gail's currently serving as the medical director and been providing oversight and review of various aspects of the SHARE transition. Vatsal Chakani. Vatsal is our biostatistician and our business intelligence analyst. Vatsal is responsible for our EMS data dashboards and help modernize the SHARE program by implementing new data architecture, if you're familiar with Snowflake, for SHARE data and applying a machine learning algorithm for case matching. These are significant improvements that allow for faster and more reliable case matching and report building. Next is Josie Johnson, our epidemiologist. Josie built the REDCap form that you're all hopefully enjoying, and she's going to be my counterpart in the technical sense. We've already made a number of changes at the recommendations of abstractors from the previous meeting, demonstrating our much better level of control over this data entry tool, over REDCap. And so Josie's going to help me with making some of the changes that you as abstractors point out to be that you might point out that you might need. And we're very happy to provide those changes and have the ability to do so where we just simply didn't have that ability in Cedar, if you recall. Ann Vosbrink. Ann is a critical team member because of her expertise with the AZ Peers data set, which is the data set that we compare and match your data to. And so that is to say the EMS data. So that data is populated by paramedics and EMTs in the pre-hospital setting. So we take their data and we match it up with yours and we see who matches. And so we need Ann Vosbrink to help us with their side, the EMS side of the data set. Julia Benton is our services section office chief here at the Bureau, and this is where the SHARE program is housed. And Julia has offered leadership across the transition through editing and reviewing, general guidance, setting up the financial support to cover the server costs of this. And so we can't thank her enough for her guidance in that. And then I'm Adam, and I work with all of you to maintain the program and hopefully expand the program. One of the major limitations of the SHARE program is that we only get outcomes from you. We only get outcomes from the participating hospitals. Without that, we would have no ability to assess our out-of-hospital cardiac care, chain of survival, moreover. So definitely, hopefully we can expand the program. I also did want to point out some of the behind-the-scenes team members who you're likely not going to interact with, but I wanted to take a few moments to illustrate the true size of the number of hands it took to get it where it is. And so you see here that we have a wonderful complement of analysts and engineers and architects and administration that came together to make this happen. So we appreciate all of their efforts, and hopefully we enjoy, you all enjoy REDCap. Okay, so some general updates, some SHARE updates overall. So the big update is that we've transitioned the registry. We've gone from collecting information in Cedar, which is still open and it's active till the 1st, till September 1st. However, REDCap is available for out-of-hospital cardiac arrest and STEMI data entry. That's the website right there. That is what you can type into your address bar to find our specific SHARE project, share-redcap.azdhs.gov. That opened for data entry on August 1st. I fully understood the burden of the previous forms, and while we appreciate what they did for Arizona and in terms of our understanding our out-of-hospital cardiac arrest chain of survival, the REDCap form and the alignment with CARES will hopefully promise to be a lot simpler and faster for you, and hopefully just overall deburdening you a little bit from data entry. So cases, so REDCap is open for those. I see that there's a number of you that have already gotten in there and entering cases, and that's fantastic. I really appreciate that. And if you haven't gotten in there, you still have time to do so, but do know that Cedar will be taken down. The old data entry system will be taken down on August 31st, September 1st, actually August 31st. And so at that time, moving forward, you will have to enter all of your cases into REDCap moving forward. And I think the most pertinent piece of information with that is that you can enter cases into REDCap from any time in the 2025 calendar year. Our IT staff is fully confident that it doesn't matter when you make that switch. You don't have to choose. We don't have to line you all up on one particular date. You can just choose when to make that switch, and we'll notice it according to your records. The only caveat is that we ask you not to enter the same record into both systems. That would be a bit confusing, although we ought to be able to catch that, honestly. So for the moment, both systems are open, but we do encourage you with not much time remaining to make that switch to REDCap, and that's why this meeting was positioned on the calendar on this particular day. Okay, and then last, I have to thank you for your efforts catching up on the 2024 calendar year data set. Many of you received giant missing lists, which we were happy to be able to once again provide to you. And your response was fantastic. We were able to match a number of cases that were otherwise unmatched. So thank you for your efforts in that. And that report is coming soon. Okay. I'm zooming in a bit on share. I like to start with, well, this is taken directly from the data entry guide, which we'll utilize here shortly. And it's meant to serve as an overarching reminder of our mission. So, and it's the only slide I'll read in its entirety. So the objective of the share program is to promote a comprehensive standardized system of post-out-of-hospital cardiac arrest care throughout Arizona, encompassing the entire chain of survival: bystanders, dispatchers, EMS providers, and hospitals. This is accomplished in part by systematically collecting, storing, and analyzing data across that chain of survival. Working together, we promote evidence-based treatment and improve survival from out-of-hospital cardiac arrest and STEMI. And so I like that just to serve as a high-level reminder of sort of what the overarching idea of share. Zooming in a bit more on the chain of survival to be specific, generally speaking, a share case is one that interacts with the entire chain of survival. So for example, if an EMS crew decides to terminate in the pre-hospital, resuscitation efforts in the field, that wouldn't be a share case because it doesn't give us a chance to look at the chain of survival from bystander identification, maybe some CPR, then EMS, and then hopefully the hospital. So we want patients that interact with the entire chain of survival, meaning that EMS has brought them to you in effort under resuscitative efforts. There are some exceptions to this. Arizona historically has collected STEMI data, whereas the national level has not. And so an exception to this would be like if a STEMI patient arrived in their own car. We would also want to know that. So that's a bit of an exception to the rule. But generally speaking, we want non-traumatic cases that go through the entire chain of survival. Okay. Some definitions we can help to utilize when determining whether I should log into REDCap and enter a case are these two. So out of hospital cardiac arrest is a yes/no question we'll ask you against this definition. So we want non-traumatic out-of-hospital cardiac arrest, where CPR is performed, EMS is involved, a transport is underwent, and there was resuscitative efforts. And so did that happen or did that not happen? And we will also ask you, was this a STEMI? Did you find STEMI on this? And we are asking you with respect to EMS. And so I'll go into that a little bit more, but we want to know, we're using you as the definitive source of whether or not EMS correctly called a STEMI, and they were correct. We want to know that. And we want to know when they should have called a STEMI but didn't. And so we're sort of using you as the starting point for should they have caught this or shouldn't they have. So we definitely don't want things like inpatient STEMIs, or we wouldn't call a STEMI that was diagnosed from say blood work, because I think we want to retain some fidelity with how EMS diagnoses STEMI, which is done via EKG, I think by specific definition. And so sticking with that, if you got a yes from STEMI out of your ED, or they went straight to the cath lab, for example, because the EMS EKG is screaming at you, and you say, okay, it's pretty straightforward. Those are marked as STEMI. Those should be marked as STEMI. And so by asking you these two questions in a yes or no format, we collect 4 patient buckets, with 3 that we're interested in, but 4 total. The one that we're not interested in is if you answer no, this wasn't an out-of-hospital cardiac arrest, and no, this wasn't a STEMI, that wouldn't likely be a shared case, although I'm sure there's a number of situations that don't neatly fit into our system. So if you're not sure, just definitely reach out and ask. But the 3 patient buckets that we do get information on utilizing this way are these here. And so we get out-of-hospital cardiac arrests that are caused by anything else, by whatever have you. Perhaps they got a drowning or an electrocution or something like this. On the other side, we get people who are affected by infarctive style processes, STEMIs and acute myocardial infarctions. And then there in the middle, we get people who suffered an out-of-hospital cardiac arrest with respect to a STEMI, with likely having a STEMI, likely having an infarctive style process. And that's an important population to denote as well. And we'll show you how we're doing that we'll show you how to answer what the forms look like with these questions here shortly. But this is the idea of the populations of what we're trying to collect with SHARE. Okay, so speaking of REDCap, if you haven't already gotten in the system, you should have received an email on August 1st from REDCap admin that says you have access granted, REDCap access granted. And that gave you an opportunity to log in to create a password and log into REDCap. If you accomplished that, you would have also seen a second email titled from Share at AZDHS titled Project Access Granted, REDCap Project Access. And that's the one that's actually adding you to our Share project. And so we are gonna go straight to REDCap, but I'll pause for a moment to see if anybody has any questions so far. Okay, great. So if you go to share-azdhs.gov and enter it, you go to this is what you'll see. You'll see the REDCap login page. Hopefully you created a username and password, but this is the page that you land on. So this is the first page you'll see once you log in, and there's only a matter of buttons across the top. And what I'm going to do is I'm going to start with 3 case entries. I'm just going to focus on entering 3 cases really quickly, just to show you a few times and some repetition about how the system works. And so for the first case, I'll drop it in the chat for those of you that want to read along. And I know this is quite abbreviated, and this isn't exactly the way your information is packaged, but it helps the point. I'm going to go to My Projects up here in the upper left, My Projects. That should add you. You should only have one in this list. You should only have Share. This is the live Share project. I'm not going to use that, but this is the one I want you to use. This should be the only one in your list, but I'm going to use our dummy account so I don't mess anything up. So you would click on Share, and now this is your project homepage. This is where all of the users in your project live. This is how you navigate your records and things like that. This is the homepage for your project. Entering a record, focusing on entering a record. You'll look over here on the left where it says data collection, and you can click on either one of these record status dashboard or add edit records to begin entering a case. You'll see here in green that it's telling me for who I'm entering a hospital. Who are you entering for which hospital are you entering data for? So for those of you that have multiple hospitals for which you abstract data, before you create the record, I want you to make sure that you are using the correct, oh, you can't see my screen. Oh, darn, it doesn't see my drop down. But, oh, actually, I need to share in a different method. Sorry, I need to share my whole screen because you guys won't see the errors and things like that I see. Okay. So before you create a record, just verifying for which hospital you are entering data in. And so you can do that using the blue button at the top. And switch to whatever hospital you'd like if you abstract from more than one hospital. So I do want to enter for this particular dummy hospital. Great. Okay, so focusing on entering a case, I can click either one of these two. I'm going to go to add edit records because that seems a little more obvious. And ignoring everything else, going to add new record. Okay, I dropped in the chat, EMS brings in a patient, CPR in progress. Efforts were terminated 30 minutes after arrival to the ED. Your staff suspects a history of poorly managed CHF as the major factor contributing to this patient's out-of-hospital cardiac arrest. Okay, this is the first of 2 surveys that you'll see. We had to break it up in this way so that we could get the data in the position we wanted to get it. So I know this might be a little clunky, but I promise you it's much better. So this first form asks you these 3 questions. Are you sure you're entering a hospital, this for the right hospital? We had to do this at the request, at the recommendation of IT, just to make sure we weren't creating any errors. So just confirm the hospital first. And then here we see the 2 questions. Was this an out-of-hospital cardiac arrest? And was this case a confirmed STEMI? And answer in any combination that is relevant. Like I said, if you say no to both cardiac arrest and STEMI, you'll see the statement that pops up that says, this may not be a valid share case. Please contact us if you have any more. So that's the only time you're going to see an error. But otherwise, let's see, our case says he was an out-of-hospital cardiac arrest, and we don't know anything about STEMI yet, so I'm going to mark no. Choose a level of completeness. This is only for you to indicate how complete this record is. How much information are you certain of? And you can leave it as incomplete, unverified, or complete. This is a pretty simple form, and I'm pretty sure this information. I'm going to pick complete and save at exit form. And this creates the record. This creates a record homepage. This creates a record identification number. And it's telling you it created a record identification number. And that was the inclusion criteria form that we filled out. That was the form that we say, are you entering for the right hospital, or is this an out-of-hospital cardiac arrest, and is this a STEMI? Once you complete that form and you save it, you then get to see, I guess, because there's a lot of logic and branching. If it indeed is a valid share case, then you get to see the share case data form. And we click into these forms by clicking on the circles here. And again, what we indicated was the level of completeness is what these circles indicate. So the second form is now more clinical. It's more patient information, and we're going to go ahead and do that now. Okay, this is more of what you were probably expecting. This is the share case data. Once it's determined to be a valid share case, we're going to ask you for some share case data. So start by telling us who brought them to you. This is a dynamic dropdown. You can enter whatever agency you'd like. There's also the option for POV if that were to be an option. But for now, let's use 3 points. Okay, first name, last name. Great. That is Mr. Share. The date of birth, when we first published this project, we had these values switched around. One of them was 1 and one of them was opposite. And an abstractor emailed and said, hey, can you make all of the date entry the same? And I said, probably. And within the day, we were able to make a small change like that. And so we were very pleased with our ability to have some fine control over this. So entering in the date of birth, you can type in 7/2/1922 and hit tab. It'll take that. You can type in 7-2-22 and hit tab. It should accept that as well. You can simply click on today and modify that field, or you can click on this calendar icon and manipulate it that way. So however you'd like to use that. The medical record number is a free text field that is 25 characters. It's a combination of letters and numbers, whatever you want to put in there for a medical record number reference. Date, time, arrival to your ED. When did EMS get to you? And again, this function is the same, month, day, year. This does ask hour, minute, though. That becomes relevant at this level. So hour, minute, and again, you can manipulate this exactly the same as any other date, time entry field. Okay, let's say they got here right now. Okay, let's see. Efforts were terminated 30 minutes. Actually, so let's back this up a little bit. Let's say that happened at like 13:50. Okay. Efforts were terminated 30 minutes after arrival to our ED. So we're going to say he died in our ED, and 30 minutes after would be now 14:20 was 30 minutes after. That sounds right. Okay. You see that we're going to ask you, was the final diagnosis acute myocardial infarction? No, it says that he was a history manager, poorly managed CHF. So I don't think this was an acute MI. And so then we're going to ask you, well, if they didn't die of STEMI and they didn't die of an acute myocardial infarction, well, what then do you think he died of? And so there's a whole list of options here. They said CHF, and this says cardiac, and perhaps that might be a bit confusing. So this would be a good time to reference the data entry manual. And so I hope I attached that in an email. I'm certain all of you have gotten a copy of it, but I can definitely provide a copy to you after this. So I'm going to reference our data entry guide, and this is navigable by clicking the table of contents. So I'm going to go down to the data status, data fields, rather. And I'm going to scroll down to the question that I have, suspected cause of initial cardiac arrest. And let's see, sorry, I have to scroll so much. There we go. Okay, suspected cause of initial cardiac arrest. I'm thinking it might be cardiac, and cardiac says, if I'm clicking cardiac, I'm saying the patient experienced a cardiac insufficiency, a cardiac issue, CHF, valvular disease, and aortic disease, something like this. So I think cardiac seems to be appropriate for this patient. So I'm going to go ahead and check cardiac. And that's why that cardiac is there, because outside of myocardial infarctive type processes, it can be cardiac otherwise. So pick from your list what your best guess is. And that, again, helps us it helps us categorize patients in that Venn diagram that you saw. Okay, comments, make whatever comments you'd like. It's an open text field. I see a lot of you are dropping in just narratives into there or something explaining a little tidbit about the case. That's great. I like that. So it helps us to understand. You don't have to. It's not a required field. Again, choose your level of completeness. So I'm going to go and verify because I'm not sure about this gentleman's name. I'm not sure if I typed it in correctly. I'm not sure if I had the date of birth correctly, but I'm going to go ahead and save and exit the form. Okay, as far as you're concerned, that's completing a record. You can go back in and edit this, but when those two dots are green, that is considered submitted. So in this system, unlike the old one, there is no button you click to send it away or submit it. When we see, as the share team, two green dots on a record, that to you is indicating to us, I'm certain of the information in that record. Also, unlike our previous system, you're allowed to go back and edit your own records. So once we determine that person's name or that date of birth, we can just simply go back into the record by clicking on that status icon, making the change that we have to. I found out his date of birth was yesterday. I was born yesterday. And update that form and now call it call it complete. I'm certain that it's complete, so I'm going to complete that and save and exit the form. And now we see two green dots, and that tells me that you're done with that record, and I'm certain of that information. And we're not going to pull this information on a daily or weekly or even a monthly basis, so you have plenty of time to go back and edit these records as you may find out who your Jane Does are or whatever have you that caused you maybe not to be certain of that information. We are pulling according to, we're pulling data according to the shared data submission schedule. So you're submitting quarterly, and then you have a quarter to get the data in, and then a day past that second quarter, the data becomes late. So really we're pulling on a quarterly basis, but it's like a 6-month lag, so to speak. Okay, so that's one record. Let me just go right back to home. We'll do it again. Let me drop another scenario in the chat, and we will rerun case entry really quick. So I hope to demonstrate how quick this is by comparison to Cedar. Okay, we're going to go to My Projects, and we're going to go into Share. Yes, I want to report for this hospital. Perhaps I don't, perhaps I do. Make sure you're reporting for the right hospital. Add Edit Records, and then Add New Record. Okay, I'm certain this is the hospital I want to enter information for. Let me read my scenario. EMS achieves ROSC in the pre-hospital in the field and arrives with a conscious patient to your ED. Chief complaint of chest pain. However, STEMI is not noted on the monitor. They're admitted to the floor where cardiac biomarkers indicate the presence of tissue damage, cardiac tissue damage, and the patient codes on the floor and expires in the hospital. Okay. Not great, but let's see if we can chart it. So this was an out-of-hospital cardiac arrest because EMS got ROSC. And so even though EMS achieved ROSC and delivered them to you in ROSC, that's still an out-of-hospital cardiac arrest I want to know about. So they don't have to be actively being resuscitated when they arrive to you, as long as it's an out-of-hospital cardiac arrest that came to you. So good for EMS in this case. They got ROSC first. They brought you a conscious patient, and no STEMI was noted. So we're going to say no, even though he's got chest pain. We found out more later. Okay, complete. indicate a level of completeness, save and exit the form to generate the record. So we get a new record homepage, just like we did last time. We see our new instrument, our new survey, our new form pop up called Share Case Data, and we'll click into it to complete it. This person was flown in by Air Methods. Okay, this was Mrs. Share. Okay, that's a female. They were born 2 days ago. Oops, born 2 days ago, and MRN numbers and letters. Okay, daytime arrival to the ED. Let's say they got here a few hours ago. This is military time, so no AM, PM here. They got here at 10 o'clock this morning. Let's see. Admitted to the floor, which means they didn't die in the ED. They were admitted to the hospital. So I'm going to click admitted to the hospital. And now we see new information popping, or new questions popping up. As you fill out the form, it will send you down the line of logic that makes sense for you. So in order to, if you're telling us they made it out of the ER, we then have to ask you what happened out of the hospital. So let's see, they expired on the floor. So that is died in the hospital. And we want date, time of discharge of death, or transfer, or or transfer, date, time, arrival to the ED, date, time, arrival. Oh, sorry, right there underneath. We want date, time of discharge if they were alive, date, time of death if they died, or date, time of transfer if you are a transferring referral facility. Okay, we see some new questions here. Was this final diagnosis acute myocardial infarction? Yeah, I think we had biomarkers showing tissue damage. So yeah, it is. So now we get to categorize the middle part of that Venn diagram that we were seeing. This out-of-hospital cardiac arrest was affected by a STEMI or AMI type process. It might be a bit confusing that we're asking both STEMI and acute myocardial infarction, and I'll take a moment now to explain that. The acute myocardial infarction question comes directly from CARES. We are aligning ourselves with CARES by asking this question. You won't see this question if you answer yes to STEMI, because we infer this by the presence of a STEMI. And so if you say yes to STEMI, it would be redundant to once again ask you about acute myocardial infarction. So by that way, you won't see this question. If you say no to STEMI, we're still going to ask you, did you find an AMI in some other way? Did you find it with blood work, or did you find it in the cath lab, or whatever other methods did you determine that this patient was having an infarction? Okay, if they made it into your hospital, we're assuming they got some type of procedure or some type of process. Admitted to the hospital can also be, sorry, let me be specific. If their ER outcome was they went directly to the cath lab, that's also admitted to the hospital, just to be clear. So admitted to the hospital is sort of a blanket term, meaning they made it out of the ED or they went somewhere directly from the ED. Okay, these are CARES questions. A while ago, I sent out the CARES questionnaire that outlined the data elements. And so we're going to ask you each one of these every time that they made it into the hospital. So did they have target temperature management? No, this person was awake and following commands. They were conscious. Was a coronary angiography done? Sure. And the date time of that would be the time of femoral puncture. Did they place a stent? Was an ICD scheduled, and was a CABG done? Are the following questions. Beyond that, comments. Again, a lot of you have been dropping in some narrative to explain it, and I super appreciate that. I'm pretty sure of all this information. I'm just going to hit complete and save and exit form. And we once again have another record generated with 2 green dots there. Okay. Last time, let's do one more, and then I will show you, we'll go over navigating the system, some of the errors you'll see on the forms, and different features of REDCap. Okay, I'm going to drop in the chat our last case. And this is a POV STEMI, and we're going to see how the record changes a little bit when we have a STEMI and perhaps a survivor. So again, I'm going to go to projects. We're going to go into share. You just logged in. You're going to go to my projects and share. I'm going to go to test share. And we are going to add edit records after making sure that we are entering information for the correct hospital. So I'm going to go to add edit records and add new record. Okay. I'm certain this is the hospital I want to enter information for. Was this case not a hospital cardiac arrest? No, this person was a POV that drove up with chest pain, and we found STEMI on the monitor as soon as they walked in. Great. Okay. I'm certain of that information. I choose a level of completeness, and I'll save and exit the form. And again, that generates a record. This record is called REC 016. It just counts numerically up from the first record you make. By completing that form, it unlocks or allows you to see this second form, the share case data form, and we'll click into that now. And again, so this is POV. This person came in POV. This is 0 share. I don't know. We'll do non-binary for this person. Date of birth is today, medical record number as usual. These are constants. You'll notice that the form is broken up into a couple different pieces. Identification demographics are always going to be there. Those are never going to be a logic-based set of the form. Once you get down to outcomes is when you'll start to see changes in the form depending on what kind of answers you put in. And they got here now. Okay, this person, let's see, this person was, arrives POV to your ED with chief chest pain, admitted to the cardiac care unit. This patient is diagnosed with a STEMI and a stent is placed. Patient survives to discharge with an AICD to be scheduled. Okay, so they admitted to the hospital. They were discharged alive, and now you see additional logic. Well, where were they discharged? And date, time of discharge. Of their discharge. Okay. In addition, we see survivor information because this patient survived. This is not mandatory information. You don't have to put in. The form will not hold you up from submitting it if you don't put this information in, because a lot of the times you don't have this information. However, with your ability to go back and edit records, if you find this information sometime after, you can always go back in and edit this information. Okay. Let's see, this patient had a stent placed. They had a, I don't know, did they get an angiography? It doesn't say that. I don't know. Let's just say no. I don't know if you can get a stent without an angiography. I'm just filling it in. Okay, they did have an AICD scheduled or placed, and I don't think a cabbage was done. Okay, make your comments, mark a level of completeness, and save and exit that form. Those two green dots, once again, are indicating to me that you're ready for this record to be taken up when on that schedule, on that quarterly schedule. Okay, those are 3 cases we put in. I'm going to show you, I'm going to go over a few minutes worth of how to navigate your project, how to find your own information, how to edit records and things like that. So I'll pause for a moment for any data entry questions, if anybody had any burning questions before I get into navigating the project. Okay, great. Great number of questions will be answered in this section, but I think I just heard a hand go up and I don't have my eyes on the chat. Oh, Erin, I see your hand is up.
Yes, I did have one question. If I have cases August 1st and forward, those are to be in share, but January through July is to be in Cedars, or put them in share?
Oh, okay. So REDCap, share REDCap is open for cases throughout all of 2025. So
Okay,
any that you want to pick from this calendar year can be put into REDCap.
Okay, great. Thank you.
Good question. Thanks, Aaron. Okay, let's talk a little bit about some of the navigating and how to control your records. So you'll notice these I don't know, tools across the top, and we'll talk about each one of them. We've been in My Projects. That's where you're entering records. That's where your project lives. The next item up here is help and FAQ. They did not separate out, this is the REDCap intrinsic data. This is like the REDCap intrinsic help library, and they didn't separate out people who build reports versus people who use or enter data abstractors. And so it's all one big thing, and I'll direct you to where we should be looking. And so if you go to help and FAQ and go to data entry and collection, this is what you're doing, and this is what the portion you're understanding. And this is going to be a lot of the questions you have in here. How do I view and enter my data? We're going to go over this. I'm not going to leave you to find all this out. But a lot of these questions are already answered in this section, help and FAQ under data entry collection. Can I delete my own record? Can I edit my survey responses? These types of things. So this is how you get some general quick questions answered by going to help and FAQ and going to the data capture, data entry and collections tab. It's probably just now occurring to me I should just link these directly into the data entry guide so you don't have to hunt these down. Okay. Training videos is another fantastic resource across the top. If you click on the training videos tab, again, they didn't separate that out for people who build the project versus people who use the project. And so for you all, the data entry overview, which again, I should link these, and I will. The data entry overview, this is a 19-minute video that goes inside of not exactly our form, but exactly how our form works and all of the logic behind it and every little button inside of it. Okay, there is communications features within REDCap. You see these two tools. Send it as an email. It serves as email functionality, and you can just send and receive emails from within here. And then even some of you have been using the messenger function, which you'll notice that the messenger slides out from the right, so you can stay on your screen with whatever you're working on and have a conversation with somebody else in your project that might know what's going on, or message me directly and I get a notification, and we can just communicate right inside of REDCap without having to worry about perhaps some of your hospitals have firewalls or numerous IT measures that keep us separate. We can communicate here in REDCap and sort of work around that, I believe, which is great. Okay, so that's like the overarching navigation of these tools across the top. So communications methods and some user help guides. Going into the actual project, zooming in about the actual project, I want to focus on the left-hand bar. This is the navigation bar over here on the left-hand side. And so just kind of working down it from top to bottom, this is a duplicate on top of the communications and assistance. This is your project home under project assign. This page is your project home. If you click project home, it just refreshes this page. You'll notice that this is titled project home here. The codebook might be of interest to you. The codebook is essentially our data dictionary, and it shows every question that you could possibly be asked. Obviously, you can't see all of the questions in any one survey because you'll have competing information, and hopefully the system will have taken care of that. But this tells you why you're seeing the questions you're seeing. So, for example, we were wondering, was the final outcome? Oh, sorry, where was it? Here. So you see the suspected cause of initial cardiac arrest, which we saw in one of our cases. And if you want to know why do I see that at that time, you see the logic here. So if you answered yes, they had an out-of-hospital cardiac arrest, but no, they didn't have a STEMI, and no, they didn't have an MI, we're then left to ask you what happened. And so so you get to see some of the logic behind the questions, and then the fields that are the drop downs that are selectable. So this might be valuable to you. However, if you're wondering about the definition of these questions, that would be better suited for the data entry guide. So again, if I want to know exactly what this is asking me, go into the data entry guide and reference the question. And hopefully that helps. If it doesn't, contact me. Okay. Okay. Staying on the left-hand bar over here, that was the Project Home and Codebook. We've gotten a little bit familiar with adding and editing records. This is what that screen looks like. But what I haven't told you about the screen is it's a way to search your records. So if you want to select one of these records that we've just put in, you can do that directly from here. You can also query your records in any one filter. So if you want to know cases that came in at a certain date time arrival of the ED, cases that were within some time frame, perhaps your survivors, I only want to look at survivors, or anybody who was only diagnosed, any of these fields, that you can slice this information any way you'd like, and you can type in whatever you want to, and it gives you all the returns of your search query there. So it's super useful. We've been going into this to start records, add, edit records. But now let's have a look at our record status dashboard. And these are both under the data collection tab on the left-hand side. This is your record status dashboard. And this displays all of the cases that you've put in. And so this is where you can manipulate your information if you'd like. So again, we can click on any of these. So you'll notice that each record has two forms to fill out, and that's because we did it in such a way where we verified it as a case by asking you those first 3 questions, and then the second form is the share case data form. So each record needs to have both of those green dots. And so here we see all the records we've entered. Again, you can kind of slice through this however you'd like. There's lots of different ways to view this. If you go into an individual record, you can just click right into it. If you'd like, you can just click on any one of your records to go into that record. If you know more information about it, say you learned an updated piece of information, just click on the record and then click on which of the 2 forms you needed to make that change on. Did you find out that it indeed was a STEMI here, or perhaps something different? So you click into it. If you need to modify this record, that can be done here. So you can delete your records, you can rename your records if you'd like. This is just the default. You can download that record's information. And that would be how to manage a single record or your library of records here. You'll also notice that there is an Add New Record button here as well. So in both of these tabs, in Add Edit Records and Record Status Dashboard, they both contain the Add New Record button. Okay. The last thing I'll show you is how to view your own information. So we've entered a couple of cases here. We have some share patients. Under the applications, working our way down on the left side, under the applications, I don't know how much use you have for a calendar. That's there. Use it how you'd like. But data exports, reports, and stats might be particularly interesting for you because it allows you to create any number of filtered reports that you'd like. Just having a look at the overall report, this is the generic report that is built in. It's just all data. It's just one giant table of all data. And so if I view that report, it gives me all of the cases I've entered, all of their information. And again, I can filter this however I'd like in a number of different ways. So this is where the REDCap user guides will come in. The REDCap, the intrinsic REDCap, the ones that came with the system, not my data entry manual. Those REDCap self-help user guides will help you to understand how to slice this information up depending on what you'd like to do with it. Okay, so that's navigating your project. When you go to your project home, that's how you move around to see what's what. That's what some of these tabs are. I wanted to kind of walk through those with you to show you that there's really nothing to click where anything goes wrong or an accidental submission or something like that. Okay, the last thing I have to show you is form errors. You will get form errors if you argue with the logic. And so let me show you a couple of more navigation tools and errors. Okay, so I'm not going to enter particular information here. I just want to get to the point where I have conflicting information to show you what errors look like. So errors occur when you enter conflicting information. So if you said they got admitted to the hospital and died in the hospital, that's fine. You only get errors if you go back and change answers against the logic. And so, for example, if I go back and change this to died in ED and just died in hospital, I will get an error. It's going to tell me that these two things can't both be true. And what would you like to do about it? So pressing OK brings you back. It erases everything that argues with that. Or if you want to stay with what it is, you can cancel it and it'll just force it. And so none of these are hard stops that says you cannot submit this record. There's just lots of warning that we're not exactly sure of this. This reset button resets all the information in that box only. So if you're worried about throwing a form error, you can just reset and not worry about. Oh, sorry. See, in this case, I reset it, admitted to the hospital, which can happen if they were discharged alive. So that's another form error. So I want to erase what causes the error and go back to where I was. This little H that you see hanging out next to each one of these, every field is timestamped. So we know, you know, you have a reference to who made what changes and what fields at what time. At the bottom, you can, if you're not sure and you've gotten kind of in the weeds, you can delete all the data on this form with this red button, and it just nukes this form and starts over. And it takes you back to square one. Do you want to start this over again? One other caution is that if you hit enter, like if I type in a name and hit enter, it thinks I'm trying to save it, and so it gives me another warning. So the lesson is to tab through. You would hit tab if you want to move down, or if you just use your mouse cursor. But if you hit enter, it's going to give you this, hey, listen, you are trying to save this record and you didn't put this information in. Make sure you put this information in, or and so it gives you a choice. I don't care, I'm going to leave, or I'll stay and play with it. Okay. Great. Save your changes. Right. Okay. I think that was everything I wanted to go over. I think I provided a high level overview of case entry, of website navigation with the tools across the top, and then project home navigation with the tools across the side. I think I'm right on time. Let me go back to our agenda. Yeah, I wanted to arrive at Q&A with 10 minutes to go. So I hope entering those 3 cases is at least observationally going to be easier. I hope that when you do get in there and start entering cases, that it's going to be much more streamlined. You'll notice that a lot of the arguments that you get out of CEDAR aren't going to be there for REDCap. And again, my goal was to one, modernize, and 2, make your jobs a little bit easier, because I know that this is a voluntary program. And so as much as I can make your jobs easier, your volunteering easier, I will. I will pause there and now ask, are there any questions about navigation or case entry or anything that we have? Thank you, Aaron. I appreciate that.
Adam, I had a question.
Yes, sir.
We're a trauma center, so sometimes it'll come in as a trauma code. You said those are excluded, basically?
Yes, sir.
I saw, like, in the drop down there, the cause of cardiac arrest was trauma.
Oh, you caught me. Okay, so I have the request in to have that changed, because another very sharp-eyed abstractor was like, if we're not including traumatic cases, why would there be a trauma option? And you caught me. So Don, that's a very good eye. I have the request in to take that off. I don't want to do that in the live project because I'm afraid I'll break it. So that is one of my IT team. Good eye, Don. So to answer, you shouldn't really be answering trauma, to be honest.
Okay.
Yeah,
sounds great. Yeah, and this definitely looks a lot easier than the previous form, for sure.
I'm glad. And as a reminder, you all will have to be using the system, or at least I would hope you'd be in the system by the end of the month entering cases, although you're still subject to the regular rotation of quarterly case entry. So, it's not like a deadline that you're in REDCap entering cases. Just know that CEDAR will no longer be available for case entry after.
And then I just have one more question.
Yes, sir.
The way I pull cases is like I'll ask for codes in the codes, sure. And sometimes they'll come in and it'll be an in the ED code. They just got in from EMS and they code, like, they weren't coding for EMS, but they code for us like a minute in. Those again would not count, right?
Technically, yeah. I really appreciate this question. Technically, that's an in-hospital cardiac arrest. So if a patient comes in with, like, they're seizing and that it's a respiratory thing, and they make it to you and then they code, that's not a study of the chain of survival, because no resuscitative skills were involved in that. So thank you, Don. That's a great point. If they're brought to you for some other reason by EMS and then they get to you in code, that's technically an in-hospital cardiac arrest, and it doesn't allow us to measure pre-hospital resuscitative efforts looking at the chain of survival.
Okay, great.
Solid question, Don. Thank you. All the questions that I get are going to be so helpful for the group, I promise. So please keep at it if you have any. I hope it made sense. I had a couple abstractors contact me about STEMI cases, and I found myself struggling a little bit to tell you exactly when to check STEMI. And so I hope the explanation of a STEMI was when I want you to check STEMI becomes a little bit clear. With respect to EMS, we want to know, did they diagnose it correctly and you confirm that, or did they miss it, and should they have caught it? And I know that's not a great way of asking that. I know, but if you have the idea of, okay, I'm answering STEMI from the background of, was it able to be caught, or was it caught by EMS, and did they or didn't they? So that's, I need to develop a little bit more refined language for that, but I hope that at least for the moment makes sense. Was there anything else anybody had about any other portion of today? Super appreciate everybody's participation. The next, I'll follow up with, I post these, I'll post the agenda and I'll post the minutes for you to review this. I'm more than happy to meet with all of you one-on-one to go over this stuff. Just ping us, ping me, ping Josie. We have a new inbox called share@AZDHS. If you just want to email just not generic, but just share@AZDHS. That's another way to reach us. I hope you guys enjoy the system. I'm keeping an eye on all of you. I know some of you are really well seasoned. Has anybody had any good experiences or bad experiences that they can comment for just the last moment or two so I can get a little bit more feedback? Thank you guys for the encouragement in the chat. Has anybody found it to be cumbersome in one way or another, or I'm not sure. I keep an eye on some of the abstractors, but I don't know if anybody in here has had any cases in, but that's okay if you guys haven't. Not a problem. Okay.
Hey, this is Jessica Danker here. I mean, I really like the REDCap. I think I've emailed you about a few barriers with share that I've had, and I think this is preventing a lot of those barriers. I think it runs really smoothly, and I found it to be a lot easier to use. So.
Thanks, Jessica. I was really looking for some validation there. Thank you. Yeah, I hope that was the goal. Like I said, we don't have an understanding of how the state's doing without you, and it just can't be as labor intensive as it was, especially when the national level at CARES is asking such a streamlined data set. We had to have modernized, and so I'm very glad to hear you say that. Okay. That's all I got for you guys. I will stay on. I'm going to stop recording. I will stay on for a few minutes if anybody wants to